So after this excellent talk by Dr. Rupakante Vishwas, my topic is whether having an accreditation status is protective in the court of law or not. So first, let us see what is a NABH, which is this is not only one accreditation center, but this is obviously the most popular one. It is a constituent board of Quality Council of India. It is set up to establish and operate accreditation program for healthcare organization. The board is structured to cater to much desired needs of the consumers and to set benchmarks for progress of health industry. The benefits of having an accreditation for your center is that it stimulates continuous improvement, commitment to quality care and patient safety, ensuring best clinical outcomes, raises community confidence among the patients as the services are provided by credentialed staff, provides marketing advantage in a competitive healthcare, and provides an objective system of empanelment by insurance and other third parties. Most of us are doing the accreditation for this last factor only. So what an accreditation process contains? It makes sure that every center has a policy and procedure on their scope of services, their registration, admission, transfer, and referral of patients, patient initial assessment, regular reassessment, policies regarding their laboratory services and imaging services, whether in-house or outsourced, safety program, and discharge protocol. They ensure that every center takes care of its patients, the uniform care, the emergency service, care of the patients requiring anesthesia, as well as surgery. There are some indicators that one center has to decide to have a continuous quality improvement. We need to have these indicators to reduce, report, and control any sorts of sentinel events, non-conformance, near miss, or hazardous condition. So effective risk management policy and root cause analysis has to be there. And it also sees that the center enforces corrective action and preventive action if any of these things happen. The most important hospital infection control protocol, it sees whether the center gives periodical training to all staffs about infection control protocols and policies. It has to have established SOPs for infection control practices, policies and protocols on the method of disinfection and sterilization, maintain and implement biomedical waste management protocols, regular monitoring of engineering department and water supply system, supervision of biomedical waste management activities. Also about the facility management and safety, NABH does provide some guidelines. The organization's environment and facilities operate to ensure safety of patients, their families, staff, and visitors. The organization should have a program for clinical and support service equipment management. The organization has provisions for safe water, electricity, medical gas, and vacuum system. And the organization has plans for fire and non-fire emergency within the facilities. About the human resource management, the center has to recruit competent people with a positive attitude towards organization and customers. So employees are selected, trained, promoted on the basis of their relevant skills and performance without any discrimination, and motivate them through reward system to provide a clean, safe, healthy, professional, and enjoyable working environment for all the staffs. NABH also have some policies regarding the information management system. There has to be proper protocols on management, storing, and retrieving the data. Medical records should have unique identifier, authorized entries, and reflecting the continuity of care. Foolproof discharge summary is very, very important. Maintaining the confidentiality, integrity, and security of information is given highest credential. The management of medication, the part where maximum errors occur. There should be the policy for storage and safe dispensing of medication, monitoring of adverse drug events, and how to have a proper prescription with patient's ID number, name and date, age and weight in case of the pediatric patients, generic name of medicine and strength or concentration of drug, doses regime, directions for use, prescriber's signature, name, time and date has to be mentioned. Also, it takes care of the patient's right and education. We have to have a signage to tell about the rights of the patients and their family members, their responsibilities, and to keep patients' information as confidential and to protect them from physical abuse or neglect. It also defines the responsibility of management. So the management has to ensure that the organization is managed in an ethical manner and to define the responsibilities of multidisciplinary committees to supervise all the previous headlines for overseeing specific aspects of quality and patient safety. So to summarize, NABH doesn't give you extra protection in the court of law. But if one is accredited, it helps to establish one's credibility as it becomes evident that all regulations are followed. And that's why you are accredited with a body like NABH. Thank you.